Have you ever stopped to think about the secrets your male body holds, and how certain habits, perhaps unconscious, may be impacting something as personal and vital as your intimate health? For many men over 60, the well-being of their penis becomes a sensitive topic, sometimes surrounded by silence or misinformation. But the reality is that a simple oversight or a deep-rooted myth can open the door to serious problems, diminishing your quality of life, your self-esteem, and your ability to enjoy yourself. Too often, men tend to downplay the small signals their body sends them, especially regarding their intimate health. They think, it's just a passing irritation, or maybe it will go away on its own. But what if that spot, that slight change in color, or that subtle discomfort when urinating doesn't go away? What if they are, in fact, a whisper from your body asking for attention? Let's talk about those whispers. A change in the color of the penile skin, persistent redness, whitish patches, or darker areas could indicate anything from a fungal infection to balanitis, or even the first sign of something more serious, such as a precancerous lesion or skin cancer, although rare. Discomfort is another crucial sign. Pain to the touch, during erections or upon ejaculation, is not normal. It could be a sexually transmitted infection, Peyronie's disease, where the penis curves due to scar tissue, or inflammation. Ignoring these pains only allows the problem to take root, complicating treatment. Variations in sensitivity are also alarming. A decrease or, conversely, extreme hypersensitivity could be related to neurological or circulatory problems. Difficulty urinating, a weak stream, frequent urge, or pain are clear warning signs of possible prostate problems, urinary tract infections, or narrowing of the urethra. Every symptom, no matter how small, is valuable information. These are not trivial discomforts. These are warnings that deserve to be heeded. By paying attention to these signs and acting promptly, you protect your physical health and safeguard your emotional well-being and quality of life. It's natural that upon hearing these whispers from our body, our first reaction is concern or even embarrassment. Sometimes the fear of the unknown or the discomfort of discussing intimate topics leads us to seek quick and discreet solutions. And it's precisely at this point that the temptation to resort to homemade solutions or miracle recipes found on the internet becomes dangerously attractive. Imagine someone who notices an unusual curvature in their penis, a decreased erection, or even dissatisfaction with its size. Instead of consulting a specialist, search forums or social media and find testimonials from people who claim to have cured their problems with exotic herbal creams, manual stretching, natural pills, or even vacuum devices purchased without medical supervision. The promise of an easy no-doctor visit remedy may sound very convincing and tempting. But dear friends, this is a trap. These solutions often lack a scientific basis and worse, can be extremely harmful. Unregulated creams can cause severe irritation, burns, allergic reactions, or even infections that worsen the initial condition. Traction devices or vacuum pumps, if not used under strict medical supervision, have the potential to cause bruising, damage to blood vessels and tissues, scarring, and in extreme cases, permanent erectile dysfunction or irreversible deformities. Promises of lengthening or thickening with at-home methods are usually ineffective at best, and devastating to health and self-esteem at worst. But beyond the complexities of seeking solutions to structural problems, there is a fundamental aspect of male health that is often overlooked or underestimated: daily penile hygiene. It seems so basic, right? And yet, neglecting this habit can open the door to a host of uncomfortable and sometimes painful problems, which have nothing to do with pills or devices, but rather with fundamental care. Think about it. The penis is a part of the body that, due to its anatomy and function, requires special attention. If it's not properly cleaned, especially in uncircumcised men, it creates an environment conducive to the accumulation of what we call smegma. Smegma is a whitish substance composed of dead skin cells, natural oils, and moisture, which can accumulate under the foreskin. It's not just an aesthetic problem. The prolonged presence of smegma is an ideal breeding ground for bacteria and fungi, which thrive in warm, humid environments. This accumulation can lead to a host of inflammatory and painful conditions, such as balanitis, which is inflammation of the head of the penis, or posthitis, inflammation of the foreskin. Symptoms can include redness, itching, burning, painful urination, and, in some cases, discharge or an unpleasant odor. Imagine the discomfort and worry this can cause, affecting not only physical well-being but also intimacy and self-esteem. A simple daily habit can prevent all of this, and it's a self-care measure as important as brushing your teeth. The key is consistency and proper technique. For uncircumcised men, it's essential to gently retract the foreskin completely to expose the glands. Then, wash with warm water and a mild soap, free from strong fragrances that can irritate sensitive skin. It's crucial to rinse thoroughly to remove any soap residue and, perhaps most importantly, dry the area completely, paying special attention under the foreskin before getting dressed. Persistent moisture is a haven for fungi and bacteria, facilitating their growth and the development of infections. Now, while hygiene is a fundamental pillar for preventing many conditions, it's crucial to understand that our body sometimes sends us other signals that go beyond a simple lack of cleanliness. What happens when, despite our best efforts or even without optimal hygiene, pain, spots, small wounds, or unexpected bleeding arise? This is where the message of never ignore takes on paramount relevance. Imagine one day you notice a small red spot that won't go away, or a persistent burning sensation when urinating, or worse yet, a small ulcer that won't heal. Your first reaction might be embarrassment, fear, or the hope that it will go away on its own. But it is precisely in these moments of uncertainty that we must act with wisdom and compassion toward ourselves. Ignoring these manifestations doesn't make them go away. It only gives them time to develop, complicate, and, in some cases, transform into much more serious problems. Pain, unusual spots, wounds that won't heal, or any type of bleeding are our body's alarm bells. They can be indicators of a simple infection, easily treatable with medication, but they could also be symptoms of something more complex. I'm talking about sexually transmitted infections, inflammatory conditions that require a specific diagnosis, and even, in the most worrying cases, the presence of precancerous cells or cancer. The key is not to panic, but to take informed and timely action. Let me share a common example. I know of cases of people who, upon noticing a small ulcer or genital wart, ignore it out of embarrassment or the hope that it will go away on its own. One young man, let's call him Miguel, did just that. After weeks of delay, his small ulcer turned out to be syphilis, a sexually transmitted infection that, without treatment, can cause very serious systemic damage. Fortunately, he acted in time, but the risk and distress were unnecessary. This example underscores why prevention and early consultation are essential, not only for infections, but also for any unusual symptoms. And prevention, in the context of sexual health, isn't limited to sexually transmitted diseases. Sometimes passion or lack of attention can lead us to situations where physical interaction goes beyond a safe limit. I'm talking about a little discussed but real facet: physical injuries during sex, particularly those caused by aggressive movements or risky positions. One of the most alarming and painful is a penile fracture. Yes, you heard right. Although there's no actual bone involved, this injury occurs when the corpora cavernosa, those structures that fill with blood to cause an erection, are abruptly ruptured due to a forceful bending or impact. Yes, a penile fracture is a drastic reminder of the importance of awareness and care in intimacy. But male sexual and reproductive health encompasses much more than acute emergencies or infections. Often, it's everyday habits, the seemingly harmless ones, that can quietly undermine long-term well-being. One of these habits, perhaps underestimated by many, has to do with temperature. I'm referring to the constant exposure of the testicles to excessive heat. Although it may seem like a minor detail, nature has designed the testicles to function optimally at a slightly lower temperature than the rest of the body. That's why they are located externally, in the scrotum, which acts as a natural thermoregulation system. When this delicate temperature is altered for prolonged periods, the consequences can be significant.